Their Destiny. We aren't going to name the patient out of respect for their privacy, but we've talked to his team and those close to him, and they tell us when he first got into rehab, he could barely sit up on his own. Now he's making a strong recovery.
I mean, they went from, sitting there being like, I don't feel so good, to being emergently ventilated.
It's been a 2.5-month-long battle for Austin's first COVID-19 patient.
So we ended up putting him on life support right away, and he ended up being on it for a month.
The 60-year-old man would spend over 30 days on a ventilator, a critical care team working with him around the clock.
We were all the staff, the nursing and RTs were one-to-one with that patient. So we were having one RT and one nurse throughout the day take care of him. Nobody else really went in the room.
But we would root for him every time. Like, we would play with the ventilator settings. Like, every time we'd go down, we'd be like, all right, is he going to make it? Is he going to do well with this? And then as soon as he would, if he would go backwards or forwards, I mean, we would be all excited for him.
But as their first COVID patient, everything was new.
Most of it was kind of learning as we go.
His team found some beauty in that, leaning on one another, watching everything come together.
Our teamwork was just very close-knit. We got to, really work one-on-one with each other.
Kind of towards the end of his stay in ICU, it was encouraging to see him breathe on his own with the ventilator and eventually get extubated and then transfer out of the unit. I think that's what made us all kind of realize this whole circle is about teamwork and kind of all of us working together to help him.
But off the ventilator and out of the ICU wasn't the end.
His endurance level was what I would call, it was fairly poor.
He was weak, and the patient needed rehab to gain back the strength he lost.
The amount of rehab that he would need to be able to get to this point was going to be, excessive compared to the normal length of stay.
Simply sitting up and moving to the end of the bed were too exhausting at first.
7 days after he got to us, he was able to walk about 5 feet. And that was epic for him. That was the start of, something that we knew we could eventually get him back home.
It took him some time, but he made it, just like he did in the beginning.
They didn't give him much of a chance when he was in the critical care unit to survive, and he was able to come through that.
I'm grateful that our first is also a success story. It gives us a little bit more hope in that regard, because not all of them are, get to leave the hospital in that way.
And Dr. Lee said that while the patient is out on his own, he'll still have to go through some at-home rehab and therapy. We also spoke to a member of the patient's family. They said they are happy to have him home and say that the nurses and doctors and staff in the ICU and in the rehab facility saved his life. Destiny.